Good morning, good afternoon and good evening, and thanks for tuning in to the One Health session at the Science Summit. I've been asked to talk to you today about regional initiative, and I'm going to introduce the European Network for Ecohealth and One Health, which was established in 2014. Firstly, what's in a name? Well, NEO started out as a network for evaluation of One Health, an EU-funded cooperation in science project, but it's since become the Network for Ecohealth and One Health, as we've expanded our scope. And as a network, we joined under Ecohealth International and formed the European chapter. But there are also chapters in Africa, Asia, Oceania, and the Americas. And we'll now hear from a few of the people who've been there along that journey.
My name is Barbara Hassler, and I work as a senior lecturer in Agri-Health at the Royal Vet College in London. In the Network for Ecohealth and One Health, I am involved in the working groups for communication and education. 6 years ago, in 2014, a group of researchers, practitioners, and decision makers interested in One Health established the Network for Evaluation of One Health with the aim to work together and develop an evaluation framework for One Health. This network, NEO, was funded from 2014 to 2018 by the EU Cost Funding Scheme. During this time, we managed to establish a very vibrant and enthused learning community on One Health, and many of the members desired a continuation of this network. Therefore, we established the Network for Ecohealth and One Health in 2018.
Hi, I'm John Berezowski. I'm a veterinary epidemiologist at the University of Bern in Switzerland. I led the small group of volunteers who transitioned the NEO cost action into the current European Network for Ecohealth and One Health. It was the desire of NEO cost action members that NEO should be unique, with attributes clearly distinguishing it from other NEO One Health networks. It should be active, focusing on tangible activities that are important to the Ecohealth and One Health communities in Europe and worldwide. The strategic placement of NEO at the interface of One Health and Ecohealth provides a unique opportunity to engage in a broad array of activities, from conventional research on zoonotic pathogens to systems-oriented social science and practice-oriented efforts, including local populations as partners in research or intervention.
Hello everybody, my name is Thomas Jänisch. I'm a researcher at the Institute for Global Health at Heidelberg University Hospital. I'm a medical doctor and infectious disease epidemiologist. For the past 15 years, I have coordinated multicentric research studies on re-emerging viral infections like dengue or Zika. As a long-standing member of Ecohealth International, I have facilitated, together with John Berezowski, the transition of NEO to become the European chapter of Ecohealth International. Our core principles build on a systems approach to health, unifying researchers with a background in human medicine, population health, veterinary public health, ecology, biology, and social science. It's a truly interdisciplinary group, which I'm proud to be part of.
Hi, my name is Gabby Lang. I'm a veterinary epidemiologist working at a human health NGO, the SCI Foundation. And I'd like to tell you about the Bologna Declaration as a basis for our One Health network. It was drafted by the NEO members at our 2018 meeting, and it aims to set out principles for delivering our network's integrative approach. The declaration emphasizes the importance of fostering an accessible and creative space where everyone can feel safe to test their ideas out. And in keeping with NEO principles of equity and bottom-up participation, we wanted to make this space an inclusive and collaborative, while being easy to engage with to ensure its usefulness and sustainability. Creating such a space, we believe, will help to overcome any disciplinary territorialism there might be, and allow us to harness the collective knowledge of the membership more powerful than just the sum of the parts.
NEO, as European chapter of Ecohealth International, has 6 working groups. The first working group is working on promoting transdisciplinarity in health sciences. Working group on communication and collaboration focuses on internal and external communication with the aim to promote dissemination, exchange, networking, and so on. Working group called Learning Organization aims to orient the NEO community towards new self-organizing purposes as field of ecohealth. Gender Working Group works on incorporating gender dimension into One Health and Ecohealth issues. Working group called Theoretical Dimension is One Health and Ecohealth focuses on investigation of the scientific concept of One Health and Ecohealth as a systematic approach to ecology and health. And finally, Working Group for Education in One Health and Ecohealth aims to provide a range of different education offers on One Health topics.
So after 2 years, the network had 48 active participants across academic institutions in Europe and have produced publications, conducted surveys, and now there's a new textbook in preparation.
Monthly meetings now, and we have 6 working groups to promote transdisciplinarity, helping to overcome some of that existing siloed thinking that might exist in many health sectors. The Gender Dimension Group, looking at a gender and human rights-based lens at the One Health approach. Communication and collaboration, trying to meet the needs of the different target audiences, such as researchers, decision makers, and NGOs. The Theoretical Dimension Group primarily focuses on the underlying scientific concepts for One Health and Ecohealth as a systems approach and discussing suitable indicators of ecology and health. The Learning Organisation Working Group outlines the principles to ensure NEO stays up to date and that we can adapt as our field of research evolves and foster that creativity that's needed. And lastly, the Education Working Group wants to help bridge the substantial gaps that exist in One Health education between different countries and sectors, and we'll talk about this a little bit more later on.
From the original network for the evaluation of One Health, the outputs were a handbook. This is available open access online if you scan the QR code, or you can follow the link. It was developed by the network across many meetings and proposes a framework for evaluating One Health approaches as a tool to aid in uptake, implementation, and monitoring. It's aimed at practitioners, researchers, funders, and I'll try to give you a quick flavour of what it includes now. So the handbook has 3 chapters. It addresses integrated approaches to health and focusing on One Health in particular as one of those approaches. How we get that shift from sectoral to integrated systems, and a One Health evaluation framework. But Chapter 4 then goes on to evaluate the contributions of One Health initiatives to social sustainability. Chapter 5 looks at the ecological dimension of One Health. Chapter 6 provides the economic evaluation of One Health. And then Chapter 7 goes on to explain how knowledge integration should be used in One Health policy formulation, implementation, and evaluation, and how that can contribute to governance. And following on from that handbook, a second working group conducted case studies applying the new framework. And these ranged from applying it to animal health policies, institutional governance structures, as well as the health interventions. And these were published in a special edition of Frontiers. And I'll just take a couple of minutes to go over the framework and one of these case studies to give you a bit better idea. Firstly, we identified One Health characteristics to evaluate so that an assessment could be made of how integrated or how One Health the project was across the different stages. Drivers, operations, supporting infrastructure and outcomes were identified as fundamental characteristics for One Health initiatives that should be considered a part of the system and the evaluation. The evaluation takes aspects of One Health operations, namely One Health thinking, planning, working, alongside those supporting infrastructures, systematic organisation, learning and sharing, as those characteristics of One Healthness to measure and then relate those to the outcomes. And this could be used retrospectively to assess how successfully integrated a One Health project was, or used prospectively to help plan. After measuring this, then it allows us to assess the added value that arises from taking this integrated One Health approach across the disciplines and sectors where it's been required. So what does that look like in practice? I shall go into one of the case studies briefly now. Here is a conventional animal health intervention which wanted to improve cattle productivity in Zambia by tackling tick-borne diseases. It was an internationally funded project which built dipping tanks so that cattle could be treated in an organophosphate bath, as you can see in the picture, to reduce the tick vectors of disease. The result was reduced incidence of disease, which led to increased cattle health and welfare and increased farmer income for farmers. The animal health project was conceived as a typical animal health intervention, meaning that the animal health was the focus of the emergency project and there was no other initial considerations made for other dimensions of that intervention. So in this example, considering the whole ecosystem, that One Health system around the use of cattle dips revealed several unintended and potentially very harmful impacts outside the intended animal health outcomes. The project identified occupational risks to the staff at the dip tanks who were suffering acute toxicity when exposed to the fluid. So then efforts could be made to reduce these potential harms through provision of personal protective equipment and making sure the local health facilities knew what to do in these cases of poisoning. Then was the potential damage of disposing of the dipping fluid that was impacting the environment and wildlife health. So this was minimised by implementing a storage period before the disposal of the fluid. Another unexpected outcome of the animal health intervention was the reuse of the chemical containers because they were good containers and households were using them for milk or water, which was then leading to chronic toxicity problems. And because we looked at that whole One Health system in this example, we've managed to identify that unexpected outcome and then implement an education campaign and safe reuse guidances that we could issue. So the NEO frameworks applied to this One Health assessment to evaluate how integrated or how One Health the project had been, and could it have been benefit from better collaboration or transdisciplinary working? Should there have been other stakeholders involved, or was there inequity in sectoral representation? Was there suitable infrastructure in place to facilitate this One Health approach? So the One Health approach, in this case, the wider project looking to avoid occupational hazards, environmental damage, or human toxicity problems arising from the animal health intervention, was evaluated using the framework developed by NEO. And if anybody wants to try this, there are some worksheets available online. And the scores in each of these areas were plotted onto our little slide diagrams we developed. And this allows there to be an easy visual representation of the level of integration present in the One Health initiative in the areas shown by the grey plot. And there can be an easy assessment of the balance between the operational One Health aspects, planning, thinking, working, covering the left diagonal area, as compared to the infrastructure aspects of systematic organisation, learning and sharing in the lower diagonal area. But given this is a relatively new evaluation framework, there isn't really an understanding of any benchmarks or what might be a desirable result for this assessment, however. And also, given that One Health initiatives under evaluation can be very varied and sometimes very context specific, it might be more desirable to consider the results of the One Healthness evaluation in comparison to other similar initiatives, where you could put two initiatives shown on the same diagram. So in this diagram, project 1 suggests a strong interdisciplinary team who took off a comprehensive multi-dimensional approach, but perhaps lacked learning and knowledge sharing infrastructure and had a mismatch between the allocation of responsibilities, authority and resources, which could have then adversely impacted the outcomes. Project 2, on the other hand, had well-developed infrastructure with well-defined responsibilities and allocation of tasks with sufficient resources, but perhaps failed to collaborate across disciplines or consider the wider outcomes for all of this at different sectors. The results of the One Health case studies were also then, all of the different case studies that we did, were then included in a meta-study along with other literature to help identify One Health initiative types and the comparison of One Health's components that might exist across those types. Following on from the evaluation framework, case studies and meta-analysis, NEO identified substantial gaps in the One Health education that's currently seen between different countries, and we want to try and bridge these gaps. As such, an entry-level open access textbook is proposed, and we want to try and get wider participation and application of One Health through it. So it aims to provide an easy to understand, accessible description of One Health concepts and the approaches, including practical information on how that can be applied. And chapters cover everything from integration of knowledge and data to One Health policy and governance, and how One Health can support in achieving the Sustainable Development Goals. While we were planning the textbook, we reviewed global One Health education and competency frameworks and found varying interpretations of what health and well-being meant in practice. An uptake of One Health can be hindered by competing priorities and a lack of coordination between global health systems. So harmonisation across scales and sectors is desirable, but it demands developing a further layer of competencies, those not necessarily for focus for health-related or health-relevant professionals. So NEO proposed an updated set of core competencies, and these are aligned with the definition of One Health developed by the One Health high-level expert panel, and should be layered on top of subject-specific expertise to deliver that workforce transformation needed to prevent and respond to complex global challenges. NEO proposed updating the core competencies and they're designed to simplify what could be a complex area, grouping the competencies into these three main areas of skills, values and attitudes, knowledge and awareness, with the several layers underlying each one. These are internationally applicable to stakeholders from various sectors and across all levels to improve that capacity building effort within the One Health workforce. And the updated competencies can be used to evaluate or enhance current curricula, create new ones, or inform professional training programs across all levels, including for students, university teaching staff, or government officials, as well as in continual professional development for frontline health practitioners and policymakers. And finally, an invitation to join us in Ecohealth International, where we have regional chapters, a biennial Ecohealth conference due to be in November, an early careers network with discounted membership for early careers. And if you have any questions, then please do get in touch. Thanks.